Hello guys, today we'll investigate the effects of sound it has on the human body, and then we'll look into sound as therapy in the clinical environment. So for the first part of this presentation, we'll look into the effects of sound it has on the human body. The first article we'll discuss is the effect of music therapy on amino acid neurotransmitters, insights from an animal study. And the researchers behind the study are from the Xinhua Hospital affiliated to Shanghai Jiaotong University School of Medicine and Shanghai Municipal Hospital of Traditional Chinese Medicine. So for the introduction, they introduce this intervention called Chinese traditional five-element music therapy. And this includes five Chinese music genres, which are gong, sheng, jue, ji, and yu. Sorry if I mispronounced any of them. But the interesting thing is each genre has a different frequency, melody, and tone. So we'll see how that plays into the study. The purpose behind the study is to understand how this intervention affects neurotransmitters such as glutamate and GABA. And the reason this is important is because neurotransmitters play an important role in regulating central nervous system functions. So some of the predictions that they made before the experiment, as you can see, Jue will have no effect to glutamate and GABA levels, while G and Gong will have uh, it's predicted to increase glutamate levels and decrease GABA levels, and vice versa for Shang and Yu. So the methods behind this study will be 56 male Wistar rats weighing 40 grams, and there will be 4 per cage under standard conditions. There will be 5 experimental groups for each genre, and then an additional group which will be the control. These rats will be randomly assigned to each group, which will be, I guess, considered for each music genre, and they'll be exposed to 2 hours of this certain music genre for 28 days. And obviously, well, the control group did not receive any music. So for the results, the first thing I want you guys to note is that the asterisk represents a p-value of less than 0.01, while the pound sign represents a p-value of less than 0.05. And the way you would read it, for example, is if you were to look on the top row middle graph, you can see that the Shang music group is created a significantly increased amount of GABA levels compared to the control group. And you can see that for every music group, it shows the amount of glutamate and GABA levels that it has produced. So for the significance and conclusion behind this experiment is that the Chinese traditional five-element music therapy affected glutamate and GABA levels in the brain. And this can be used in the clinical setting to increase GABA levels for depressed and epileptic patients, since that is the main function of GABA. And then for glutamate, raising glutamate levels will increase neurocommunications. And the reason this could be good in a clinical setting or for anybody, especially for patients that uh, have the substance abuse disorder, will lead to enhanced neuroactivity, which will lead to cell growth. So for the next article that we'll discuss, it is called The Influence of Music Liking on EEG-Based Emotion Recognition. And the researchers behind the study are from the Indian Institute of Technology, Kharagpur. For the introduction, the researchers discuss how biological signals used in emotion recognition studies consider facial expressions, speech, and physiological signals. And the reason an EEG is used to measure emotion is because emotion only lasts for such a short duration, and an EEG has a millisecond precision, which would be the best measurement. And the purpose of this study would be to record neural activity in subjects and investigate the influence of their music liking on emotional recognition. And the 3 factors that will be measured during this experiment will be arousal, which will be the level of excitement, valence, a scale from pleasant to unpleasant, and dominance, the ability to be influenced or controlled. The methods of the study start from 40 subjects, and they all watch a 1-minute excerpt of the music video. While they're watching the music video, an EEG is taken, and after they're done, they'll report their felt emotion. And for the data analysis, the researchers will use or used a dual tree complex wavelet packet transform and Spearman's cross correlation. So what they found from the study is that certain moods of music, such as happy or sad, and genre can be identified within 250 milliseconds of listening. And music listening is needed to initiate emotional judgment, as well as emotional response and state evolve as the music unfolds. Even though genre can be identified within 250 milliseconds, it takes an average of 8.31 seconds of music listening to initiate an emotional judgment, which is still a pretty short amount of time, but not compared to milliseconds. So the significance and conclusion of this study is that the emotions for arousal and dominance were most discriminative for low likings of music as compared to high likings of music. And then the difference in emotional judgment is apparent from the type of music that they listen to. So from this, we can understand that the use of certain music in a clinical setting can greatly influence emotional judgment, especially within seconds. And because judgment can arise within seconds, it is important to choose the right type of music, as this will play a role into first impressions in a clinical setting. The next article we'll discuss is called The Influence of Autonomous Sensory Meridian Response on an Individual's Executive Function. And the researchers behind the study are from Peking University. So for the introduction, they explain what autonomous sensory meridian response, as known as ASMR, which is a phenomenon where people respond to auditory stimuli by experiencing a tingling sensation or euphoria. And previous results of different studies have implied that ASMR can actually affect one's cognitive performance. So for this study, they'll examine how ASMR affects people's executive functioning, which in this case will be working memory, set shifting, and inhibitory control. The methods that will be used for this study start from 212 participants, where 2 screenings will be done to assign them to either experimental or control group. And the participants will listen to 3 minutes of ASMR and then answer a survey of their experience, where they'll rate from 0 to 6, 0 being no tingles, where 6 is intense tingles. They also conducted set shifting by using the number letter task, which is a brain game for determining whether a number is even or odd and if a letter is lowercase or uppercase. So we can see from the charts that on the left is the ASMR's effect on set shifting, and then on the right is ASMR's effect on inhibitory control. So based on the data that we can conclude that ASMR groups showed a higher degree of comfort than the control group. However, ASMR and control participants did not intrinsically differ in executive functioning, such as working memory, set shifting, and inhibitory control. Also, ASMR individuals did have an atypical brain network compared with control patients. However, there's no further discussion what the implications behind this are. So the significance of this study is that this is the first study to examine the difference between ASMR and the control population on executive functioning. Even though ASMR did not have an effect on executive functioning, in the case that it is found to do in the future, executive functioning such as memory is important for patients and regimen adherence. One of the main reasons for non-adherence is forgetting the proper protocols and when to take the medication, which is an issue doctors face in the clinical setting. So strengthening these executive functions in the clinical setting can be a type of intervention and prevention to non-adherence. The next article we'll discuss is called Positive Effects of Music Therapist Selected Auditory Stimulation on the Autonomous Nervous System of Patients with Disorder of Consciousness, a randomized controlled trial. And the researchers behind the study are from the China Rehabilitation Science Institute. The introduction explains what disorder of consciousness, or DOC, is, and it's a disease that seriously affects a person's ability to interact with the outside world. And facing this issue, it was found that musical stimulation is a therapeutic technique used to bring patients with severe DOC out of unconsciousness. So musical stimulation can be used as a rehabilitation for patients with severe brain trauma. For the musical stimulation to be effective, listeners must have similar cultural background as the music. So the example would be classical European music does not have the cultural significance for Chinese listeners. And the purpose of this study would be to compare and analyze the effects of different auditory stimulations in participants with DOC. The methods behind this study start from 26 participants which were recruited, and participants must be minimally conscious, and they were aged from 18 to 70. They must have tolerance to therapy in a probe position, must be ready to receive routine therapy, and have no professional experience in music. The study was randomly controlled, and it was a double-blind design. The experimental group received therapist-selected music, while the control received their own preferential music. In other words, they got to pick their own music. And patients received auditory stimulation for 30 minutes a day, 5 times per week for 6 weeks. And to measure this, they used a neurobehavioral tool called SMART. And for the results of the study, it was found that the therapist-selected music outperformed patient-preferred music at stimulating aspects of the autonomic nervous system in patients with DOC. So, preferred music did not have a longitudinal positive effect in a clinic, and therapist-selected music is more effective. The significance and conclusion of the study was found that in a clinical setting, practitioners should select music for DOC patients. Clinicians and professional music therapists should work together to make a clinical treatment for DOC more effective. And while more studies is necessary to assume the same effect with other types of patients, such as patients with substance abuse disorders, this study brings an optimistic future on how music may play a positive role in the clinical setting. The next article we'll discuss is called Autonomous Sensory Meridian Response, ASMR, a flow-like mental state. And the researchers behind the study are from Swansea University. So for the introduction, they explain how ASMR has a growing interest and community, and how it can provide temporary relief to individuals with depression, stress, and chronic pain. And they discuss this conceptual idea called flow, which they defined as a state of intense focus and diminished awareness of the passage of time that is associated with optimal performance in several activities. And the purpose of this study is to describe sensations associated with ASMR, explore the extent to which engagement with ASMR may ease symptoms of depression and chronic pain. So for the methods of the study start from 245 men, 222 women, and 8 non-binary aged from 18 to 54 from the USA. And an online questionnaire was used to understand the prevalence of ASMR in this population, such as their viewing habits, triggers, location of tingling if they get any, and reasons for watching ASMR and the effect it has on their mood. They must indicate if they suffered from chronic pain to rate their mood, and they must rate their mood in a typical day from 0 being the most negative to 100 being the most positive. And lastly, participants answer a flow state scale to determine their amount of flow, as discussed in the previous slide. The results from the study, you can see from table 2, whispering apparently was the trigger the largest percentage, whereas laughing triggered the least amount of participants. And on the right, you can see the correlation between flow and triggers. So 81% of the participants preferred engaging with ASMR before going to sleep. And 3 participants stated that their medication actually influenced their ASMR experience. They did not list what medication it was specifically, though. 80% of participants responded positively that ASMR influenced their mood, and 30 participants reported that ASMR improved their symptoms. So, we can say that ASMR provides temporary relief in mood for those suffering from depression. Individuals who scored highly on flow measures reported regularly experiencing high numbers of triggers. And also, the response of ASMR differs by individual. However, the overall satisfaction is pretty high. And the reason this is significant is because of the positive effect ASMR has on depression. This could be used in a clinical setting to relieve patients who are experiencing either anxiety or depression or possibly any chronic illness. The next article we'll discuss is called A Functional Magnetic Resonance Imaging Investigation of the Autonomous Sensory Meridian Response. And the researchers behind this study are from the University of Winnipeg, Ryerson University, and University of Manitoba. So for the introduction, they explain that ASMR can affect or cause triggers within the autonomous nervous system, and that previous research has used neuroimaging techniques to identify potential differences between the brains of individuals with matched controls. So similarly, the purpose of this study would be to identify brain areas associated with ASMR experience by comparing the ASMR or experimental group brains with the control brains. The methods of this study will start from 17 participants, where 8 of them are males and 9 of them are females from Winnipeg, Manitoba. And no participants reported having a neurological injury or psychiatric illness, which eliminates those confounding variables. So for the procedure, a 7-minute MRI scan and 6 5-minute fMRI scans were completed on each patient or participant, and then 6 ASMR videos were presented during the study. And some examples of these types of videos include stimulated lice check, makeup application instructions. Participants reported what they experienced after watching the videos. So the first thing to note is brains A, B, and C are from the ASMR participants, while brains D, E, and F are from the participants of the control. And the main difference you can see is that in the brains of the ASMR participants, we can see an extra brain region being stimulated, while we do not see that region being stimulated in the control brains. So this extra region is the right cuneus. Control participants showed significantly decreased activity in the right cuneus while watching and listening to the videos. Individuals with ASMR demonstrated greater activity in both the precentral and postcentral gyri during viewing of the ASMR videos than control videos. And then lastly, ASMR videos enhance the activity in the visual and auditory cortices. Oh, sorry, ASMR videos enhance activity in the visual and auditory cortices may be linked. So the conclusion that was made is that ASMR showed increased neuroactivity related to attention, audition, emotion, and movement. Enhanced neuroactivity actually leads to cell growth and increased oxygen flow to the brain, as discussed earlier, which could lead to improved memory and attention. This could be used in a clinical setting to influence healthy behavior in patients and maintain attention, especially patients with substance use disorder. Next, we'll explore sounds in the clinical setting. The first article we'll cover on this is called The Effect of Musical Therapy on Stress in Chemically Dependent People, a Quasi-Experimental Study. And the researchers behind the study are from the University of Rio de Janeiro. So for the introduction, they discussed how harmful use of drug characterizes a type of use that results in physical or mental harm, and that stress is the most contributing factor to compulsive behavior during drug dependence. And the purpose of the study would be to explore whether music therapy is able to reduce stress in chemically dependent people. And for the first bullet point, I wrote how there's currently a global pandemic of drug use. I thought that was necessary going along with this study, and I included this graph uh, that covers the increased drug use from year to year, including drugs from marijuana to hallucinogens. The methods of the study will be 18 participants, all above 18, who do not use cortisol inhibitors, such as glutamine, vitamin C, whey protein, green tea, and magnesium. So use of any of these drugs would inhibit any cortisol production. Uh, that would be an issue because cortisol is measured in the saliva to determine stress levels in an individual for this experiment. So, single music therapy session encouraged participants to sing and listen to songs along with an accompanying guitarist. This session lasted for 2 hours, and songs by famous Brazilian singers such as Beto Guedes and Cazuza were played. And as mentioned earlier, cortisol was used as a biomarker to measure stress level. So the results of the study found that a statistically significant reduction in the mean salivary cortisol levels were found after 60 minutes of music therapy. A reduction of cortisol levels was found for the next 60 minutes, but this time without any statistical significance. So we can conclude that this format of music therapy is effective to reduce stress during treatment of chemical dependence. Uh, and this is significant because the possibility of implementing this type of therapy in mainstream society is close to happening. And then the optimism for discoveries of different musical therapies and interventions uh, allow a gateway for more different types of music therapy that can be implemented into different clinical situations. So, decreased stress is important in a clinical setting, which was found from this experiment. The next article we'll discuss is called Music as an Auditory Cue for Emotions and Cravings in Adults with Substance Use Disorders. And the researchers behind the study are from the University of Queensland. So for the introduction, it explains how strong emotions are one of the most widely cited maintain factors for substance misuse in that the substance numbs or alleviates negative internal states, which makes sense. And from another study, music played during substance use was reported to enhance the euphoria from the substance use. Most well-established experimental protocol for examining listeners' emotional responses to music has been to record individuals' responses to specific musical stimuli. So, for the purpose of the experiment, it is to examine the relationship between music listening and craving for substances in the SUD treatment sample, or as known as substance use disorder. The method of the study is from 19 participants, 9 female, 10 male, who lived at the therapeutic community for an average of 64 days for treatment. And this is the therapeutic community in Australia. Sorry. Uh, so in this community, there was complete abstinence from alcohol and drugs besides medication that was provided. And also an additional 19 participants that do not have SUD were used as the control. Participants would listen to 14 genres, rating each music genre, and then craving measures were taken using the alcohol urge questionnaire. Also, participants were asked to rate 3 types of classical music: uh, relaxing, happy, and sad. Now, the chart on the left shows each of the participants naming an urge song, so a song that gives them the urge to use drugs, and then a clean song that does the opposite, which I think is pretty interesting. And then on the right shows the the uh, graph of the control group and then the SUD group rating from very unpleasant to very pleasant on the three types of classical music: relaxing, happy, and sad. And you can see from the graph that there's not really a major difference between the two groups. So the results found that the SUD sample rated happy and relaxing pieces to be significantly more pleasant than sad music. Similar results for classical music, but to a lesser degree, was found in the control group. Uh, there is significant increase in craving from baseline to urge, and a significant decrease in craving from urge to clean song. So a baseline song in this case was a neutral song, I guess a song that was neutral to a participant. And group difference was most pronounced for happy music. So it was concluded that possible explanations for the between group differences was the presence of depression in the SUD group, which is an example of a confounding variable. And changes in craving between baseline and urge songs was not that dramatic, but was observed for a majority of participants. And the reason for these modest changes could be explained by the fact that the participants were already settled in rehabilitation. So results could have differed uh, before the participants were taken into rehabilitation. And the main takeaway and significance from this study is to understand that certain music in a clinical setting may cause craving or negative effects. So a use of clean song and or relaxing happy music may be most effective in a clinical setting. So for the next article, we're going to discuss the effects of music therapy under general anesthesia in patients undergoing abdominal surgery. And the researchers behind the study are from the University of Medicine Ibn Jazar. The study introduces itself by discussing how surgery and anesthesia are generally unpleasant experiences for patients and are the source of stress and anxiety that can hinder the desired therapeutic goal. A frequent and serious mishap during anesthesia is awareness, which could have a better outcome with music therapy. So the purpose of this study is to evaluate the effects of music therapy under general anesthesia on patient satisfaction, anxiety levels, intraoperative awareness, and the intensity of pain during recovery from abdominal surgery. The methods used for this study include 92 patients randomly grouped into two groups, all above 18 years old, and the patients wore a headphone linked to an MP3 player during the surgery, and the MP3 player included different types of music samples. The music started immediately after anesthesia started, and the volume was set at 65 decibels. And lastly, the quality of awakening was assessed by the Riker scale. So the chart on the left shows the changes in blood pressure over time during the surgery, and we can see that the control group has large fluctuations in blood pressure, while the music group levels off. On the right, we can see the effect of music therapy on recovery quality, and if we look closely, we can see that the music group had a higher percentage of calmness and a lower percentage of agitated feeling compared to the control group. So the results show that the most frequently chosen music by patients was Tunisian music, most likely because the patients were all Tunisian. And as said before, more stability in group M for systolic arterial blood pressure over group C. And then the surgery satisfaction rate was significantly higher in group M. However, difference in heart rate was not significantly different. Lastly, recovery quality, as said before, was better in the intervention group and had a significant reduction in stress. So other studies have found that different results with no hemodynamic changes have occurred. So there's some conflict with that. Only patient operated, and only the patients were operated in the visceral area were included, which limits the generalization of the results. Um, so this is an extreme example of music therapy in a clinical use, as the main focus of this presentation is to look at music therapy in a more usual clinical setting, such as a doctor's office. And lastly, the implementation of music therapy in a clinical setting may produce positive results based on this result or experiment. So the last article we'll discuss in this presentation is called Music Therapy and Emotional Exploration, Exposing Substance Abuse Clients to the Experiences of Non-Drug Induced Emotions. And the researchers behind the study are from the University of Queensland. So the experiment introduces itself by explaining that treatments designed to increase individuals' emotion regulation skills and decreases in their avoidance have been effective in the treatment of anxiety disorders. This goal could be approached by implementing music theory, which is similar to what the purpose is, determining whether a music therapy program situated within a cognitive behavioral therapy framework facilitated the exploration of emotions in adults with substance use disorder. The methods for this experiment uh, are 24 participants that were recruited from a specialist drug and alcohol rehabilitation unit in Brisbane, Australia. The participants were recruited over a 7-week period where the mean age was 34.4 years, ranging from 17 to 52 years. The music therapy sessions were conducted 5 days a week, and clients were never forced but strongly encouraged to attend. The therapy included lyric analysis and song listening. However, because the main focus of this assignment or presentation is mostly catered towards song listening, uh, this is why this article was chosen, even though it included some lyric analysis. So from the results in Table 1, we can see that the music therapy uh, caused 65% of the participants to be happier. And in Table 2, we can see that uh, the frequency of people who enjoyed and found this therapy to be extremely enjoyable was very high, and that no participants indicated no or little enjoyment. The results found from the study are that 65% of the participants indicated that music often has an uplifting, happier, positive change on their mood state. 83.4% of participants found the sessions enjoyable or extremely enjoyable, and no participants reported the sessions were not enjoyable or just a little enjoyable, as stated before. So most participants experienced a positive mood change. However, negative emotions were also endorsed by the participants, which is necessary uh, to include in the study. So the significance and conclusion from the study is that music therapy sessions within a cognitive behavioral therapy framework can invoke a range of positive and negative emotions in participants with substance use disorder. Uh, Thoughts on this session: majority of the participants enjoy the music therapy sessions, meaning that they were able to tolerate the emotional experiences without the use of substances. Uh, This this type of therapy could possibly be used in a detox clinic where patients may have trouble functioning without substances, and this could evoke a positive mood and in an environmental uh in an oh this can possibly evoke a positive mood in an environment patients may view negatively. And here's the works cited for this presentation, and that is all.